Well, good evening, everyone. I am not Ben Viola, as you probably can see if you have my faces on your screen. So I'm Keith Wrightington, standing in for Ben tonight. So here I am with Dr. Baritz and the Nutrition and Acupressure series. We're going to kick that off tonight. I'm sure Dr. Baritz will have a few things to say to you about some upcoming webinar ideas that we've been batting around here for a little bit. And so you can put those in the chat box. Any of your questions, I'll navigate the chat box or even the Q&A box, depending on where you guys tend to put them. And any questions, I will get them to Dr. Baritz. So without further ado, here is the man of the half hour, Dr. Baritz.
Hi, great to be here today. You know, nightmares, I don't know if you've ever had a bad nightmare. Matter of fact, if you've had a bad nightmare, if you tend to have them, I'd like you to throw that in the chat box. I don't have them very often, but I've had some doozies that seem incredibly real, even more. Matter of fact, I've had nightmares that seem more real than when I wake up than real life. And so, you know, I'm not just I'm not just a customer, you know, a provider, I'm a customer too. Of course, nightmares are much worse for children because they're much smaller and much more at the effect of things. So I put my brain together to create this program, you know, for my patients and your patients on combining acupressure and nutrition to really beat the nightmare scenario. A nightmare is a disturbing dream, often associated with anxiety or fear that wakes one. The word nightmare is derived from the Old English mare, a mythological demon or ghost who torments others with frightening dreams. Common features of nightmares include vivid dreams that become more disturbing as the dream unfolds, a storyline featuring threats to safety or other disturbing themes. You wake feeling anxious, angry, sad, or even disgusted. You feel sweaty or have a pounding heart while in bed. Your dream causes distress that keeps you from getting back to sleep. During the day, nightmares can leave you feeling distressed, anxious, tired, and you can have trouble with memory. Sometimes you can't stop thinking about the images from the nightmare the night before. Although the exact cause of nightmares is not known, we do know that trauma, stress, anxiety, and certain drugs can increase the likelihood of having a nightmare. Treatments include stress reduction, herbal teas, using a nightlight, avoiding eating after dinner, and establishing a relaxing routine before bed. And if you have any remedies that you've used for your patients or your family, I'd like you to throw it in the chat box so I can discuss that or let the rest of the group know about that. While these treatments may help, they may not be enough. Acupressure nutrition can bring life back into life and help one have a good night's sleep. Experienced nutritional practitioners have had great success using certain supplements. And acupuncture point stimulation has been used for hundreds of years to relieve nightmares and to improve sleep. Here is the quick reference guide that I've created for you and your patients. There is over here is the link that they can click if they decide they want to watch the video. And here is the how to locate acupuncture points. And this course defines terms like anterior and posterior, proximal and distal, and shows the images of a Thun or 3 or 4 Thun. And here are the points for nightmares, stomach 12, conceptual vessel 14, and heart 3. Of course, we'll go over into those in great detail. Here are the supplements. And they are listed according to importance. And the most important one that has long been used in standard process is the AC carbamide. Lifestyle recommendations, I put that in. These are the same ones that I went over just a few moments ago. And here's the medical advice disclaimer. Over here is the courses that I've offered to your patients: how to heal a concussion fast, improving erections, new hope for Alzheimer's, and carpal tunnel syndrome. And my new course coming up, how to help your dog be happier. Okay, supplements and acupressure points for nightmares. AC carbamide, as I said, is the most important product, and the dose is 1 to 3 twice a day. It promotes the healthy formation and excretion of urine, promotes healthy fluid levels, supports healthy urinary system function, and promotes healthy cellular fluid levels. It's recommended really for any condition with water retention, including glaucoma, which is simply fluid retention in the eye. It's said to reduce excess fluid around the brain, which is believed to be a cause of nightmares. Calcium lactate powder, 1 tablespoon, 3 times, 1 tablespoon, 1 to 3 teaspoons in the AM, and 1 to 3 teaspoons before bed. Supports muscle contraction and nerve conduction, supports maintenance and function of cell membranes, supports proper function of enzyme systems, supports and helps maintain healthy bone density, supports immune system function. Now, I listed this as a powder because that will be easiest for children to take or even infants to take. However, adults certainly can take tablets. Just for your information, 1 tablespoon of the powder equals 600 milligrams, and it takes 7 tabs to reach 1 tablespoon. And I usually run that down to 6 tabs if a person is using tabs. There is more calcium in the human body than all the other minerals combined, and more calcium supplements are sold than any other mineral supplement worldwide. But many of these supplements are poorly absorbed, and I've seen them on lumbar x-rays just waiting to be eliminated. Calcium lactate is a very absorbable form of calcium and magnesium in the proper sweet spot 5-to-1 ratio. This is another reason why I always choose to offer standard process supplements, because I know I'm going to get a quality supplement that's going to actually be absorbed into the body, or at least have a chance of being absorbed into the body. The next product is Antranex. Antranex contains yak kraton, a liver fat extract discovered by Japanese researchers that is used to support the body's detoxification mechanisms. Yakatron is the blood filtering fraction of the liver. So Antranex facilitates the detoxification of blood in its flow through the liver. Antranex is a natural antihistamine, excellent for people who have excess histamine as an allergy and asthma. I always use this for patients who are having trouble with hay fever in my office. And a pro tip for you, if you add a Cal-Ammo, 1 tablet of Cal-Ammo with 3 tablets of Antranex, you get a more potent effect. And if patients are having allergy attacks, I tell them to chew up, if they can handle it, 3 Antranex and swallow 1 Cal-Ammo every 15 or 20 minutes until they're feeling better. We sell a ton of this in my office in allergy season. And as a former allergy sufferer, I know how much value this has. This product was not originally created by Dr. Roy Lee. It was created by the Japanese. And then I believe Haro Labs in the 1940s took it over. And then when Haro Labs closed, Dr. Roy Lee was so in love with this product that he said, well, I'm just going to take it over and produce it myself. I don't think anyone else is producing it. The next product is Conjuplex, and that's an interesting product for nightmares, but it does support healthy immune system response function. So if the immune system is off, the person is beginning to have a cold or a flu or something, this may be a cause of nightmares. So we're getting to the cause, the underlying cause of these nightmares, instead of just treating them superficially. Of course, Conjuplex provides nutrients that support antioxidant activities. It supports the thymus gland, which is so important for immunity, and it contains ribonucleic acid, which the body uses to build new cells. Conjuplex is the primary product that I recommend for colds, flu, congestion, inflammation, and any infection. And so patients also call this Congoplex, like in the conga drums, but it's really Conjuplex as in congestionplex. I recommend as much as 4 times a day, and after the acute phase is over, I recommend 6 to 12 for at least 1 to 2 weeks. Also consider Catalin, 1 to 3 twice a day, and this is if you suspect the person has poor nutrition, which of course can be a cause of a lot of things, including nightmares. This was Dr. Royaley's first product. It contains vital nutrients from whole foods and other sources designed to bridge nutritional gaps in the diet. It encourages healthy cell functioning, and it supports overall well-being. What's not to love about Catalin? And now we get to the video and the acupuncture points, how to stop having nightmares.
Hello. In the next few minutes, I'm going to show you a simple procedure to help you stop having nightmares. A nightmare is a disturbing dream, often associated with anxiety or fear, that wakes you. The word nightmare is derived from the Old English term mare, which is a mythological demon or ghost who torments others with frightening dreams. Common nighttime features of nightmares are vivid dreams that become more disturbing as the dream continues, a storyline featuring threats to safety or other disturbing themes. You wake feeling anxious, angry, sad, or disgusted. You feel sweaty or have a pounding heart while you're in bed. Your dream causes distress that keeps you from getting back to sleep. The day after having a nightmare, you can feel distressed, anxious, and you might have trouble with memory. Sometimes one can't stop thinking about the images from the nightmare. Although the exact cause of nightmares is not known, we do know that trauma, stress, anxiety, and certain drugs can increase the likelihood of having a nightmare. Treatments include stress reduction, herbal teas, using a nightlight, avoiding eating after dinner, and establishing a relaxing routine before bed. While these may help, they may not be enough. Acupuncture has long been used to relieve nightmares and improve sleep. In this video, I'm going to show you how to locate and activate 3 acupuncture points to reduce the frequency and severity of nightmares or to stop them altogether. My name is Dr. Baritz. I'm a chiropractor, nutritionist, herbalist, and I'm certified in acupoint physical medicine. I've helped thousands of people live better naturally, and I want to help you too. If you like this video, please give me a thumbs up, subscribe, and hit the bell icon to be notified when more videos come out. The first nightmare relieving point I would like to demonstrate is stomach 12. Stomach 12 is known as empty basin, signifying its ability to clear the body of bacteria, virus, fungus, and toxins. Stomach 12 is believed to reduce nightmares because of its detoxifying effects. In addition to helping reduce nightmares, stomach 12 has been used to improve lymphatic drainage, reduce neck and shoulder pain, as well as alleviating both coughing and breathing difficulties. Stomach 12 is located just above the middle of the collarbone, which is sometimes called the clavicle. To locate stomach 12 on your left side, locate the notch at the base of your neck, right over here. Then locate the outside end of your collarbone right over here. Now locate the midpoint right over here. Come up over the bone and press in to find a spot that is sensitive, sore, tender, or painful. That is stomach 12. Activate this point by rubbing it 5 times quickly. Take a break for count of 5 and repeat 4 more times. It might look like this. Or if you have a Tay shin, it might look like this. Now locate and activate stomach 12 on your right side. After activating stomach 12, gently turn your head from side to side. And notice if your neck and shoulders feel a little less tense. The next point of this powerful group is conception vessel 14. Conception vessel 14 is known as the Great Gateway. In addition to helping reduce nightmares, conception vessel 14 is used to improve sleep, relieve symptoms of acid reflux, nausea, and heart palpitations. Conception vessel 14 is said to calm the spirit by reducing nervous system overload. Conception vessel 14 is located between your belly button and the sternum. To locate conception vessel 14, find your belly button and place your hand just above that. Now find the point that's just above your hand and find the spot that is the width of 2 thumbs above that, right about over here. Push in to find a point that is sensitive, sore, tender, or painful. That is conception vessel 14. Activate conception vessel 14 by rubbing the area quickly 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tay shin, it might look like this. After stimulating conception vessel 14, take a few deep breaths. And gently twist from side to side. Your core just might feel stronger and more stable. During or shortly after stimulating conception vessel 14, you may notice a sensation of heat or energy in your abdomen, back, or chest. This is normal and therapeutic. The third point for relieving nightmares is Heart 3. Heart 3 is known as Lesser C. Heart 3 is located on the inside of your arm, halfway between the tip of your elbow and your elbow crease. Heart 3 is said to relieve nightmares by calming the heart and reducing nervous system overload. Heart 3 is said to restore memory, improve arm range of motion, reduce trembling of the hands, and improve weight management. Heart 3 is located on the inside of the elbow joint, between the tip of your elbow, right over here, and the center of your elbow crease, right over here. To locate Heart 3, put your finger on the tip of your elbow, then move towards your crease. You'll come over it and off a bone. Once you come off the bone, push in to find a point that is sensitive, sore, tender, or painful. That is Heart 3. Activate this point by rubbing the area quickly 5 times. Take a break for a count of 5 and repeat 4 more times. It might look like this. Or if you have a Tay shin, it might look like this. Now locate and activate Heart 3 on your right arm. After activating Heart 3, take a deep breath. Move your arms around. And then just take a look around the room. Things might be looking a little brighter or a little sharper. And your joints just might feel more flexible. This is normal and expected. Repeated treatments deepen results. If your sleep is disturbed by nightmares and you want to sleep better, I suggest that you activate Stomach 12, Empty Basin, Conception Vessel 14, the Great Gateway, and Heart 3, Lesser C. Before sleep, at any time you wake during the night, for for the next 30 days. Then continue as needed. And if you know someone who has been having nightmares, I encourage you to share this video with them. It is intended to help improve sleep and just might get rid of those nightmares.
All right, so that completes the video. Keith, if there are any questions or comments, I'd like to address those now.
Perfect. Well, we definitely have one question. So Mark was asking, is it the same points for night terrors that you just showed for nightmares?
Yes. Yeah.
Okay.
Good question. Yeah.
Yeah. All right. So they can use, you can be used synonymously.
Yeah. I mean, they're not really synonymous. Night terrors are much more severe, but I think it's on a gradient scale, you know,
Okay.
from a bad dream to a nightmare to a night terror.
Perfect. All right. Let me double check here. Let me look in the chat box. So that was the only question.
Great.
Thorough.
There any comments that are mentioning here?
No, do you want to ask the rest of the group about maybe some of the upcoming ideas you had for?
Yeah, so for our next webinar, I have a couple of choices.
Well, actually, we have two questions here that were in the chat box buried in there. So let me
All right.
let me get to those. So
Right.
Christine was wondering, what is your estimation that makes folks remember their dreams? She can't recall dreams, sometimes distressing when I take Cataplex B Core before bed. I have tested this. So what is your estimation that what makes folks remember their dreams?
I think they remember it if they wake up right mid-dream,
Okay.
you know. That's not based on any scientific
Yeah, right.
knowledge.
Which might not actually apply to the points you were talking about. And the next one is, do you feel that AC carbamide increases urination? So taking it at evening time may increase urination during the night.
It does increase urination. It has a diuretic effect.
For sure.
So probably, and it doesn't have to be taken before bed. It's not like a topical. So they could take it earlier in the day, in the morning, or during the day. That's a good point.
Yeah, very good point. And just let me make one point here while Dr. Baritz was on the webinar. I put in a few things about AC carbamide. So if you want to go in the chat box, I left a couple links that you can click on. One was about vitamin F, carbamide, and calcium metabolism. The other one was about the physiology of urea. And then I just put a quote about opiates in carbamide at the bottom. So check those out.
Cool. I do want to mention that, so we have a couple of options for our next webinar: osteoporosis, osteopenia. Very interestingly, there is scientific evidence showing that certain acupuncture points are helpful for these conditions. Not just preventative, but positively helpful. PMS, another one is how to have a happy pregnancy. Another one is rapid relief from TMJ pain. And two lung ones. The first is COPD, which, as you know, is it's a progressive condition that generally causes considered to be irreversible damage, only getting worse over time. So if you know anyone, or you have any of your patients have COPD, treatment is really indicated, because we want to address that as soon as possible. And then how to increase oxygen level even if your lungs have been impaired. And we're doing a lot of this with our patients who have post-COVID lung symptoms, long COVID, that sort of thing. So these are the choices. I know I've given you a lot of them. There are 5 choices. So just to run them by once again: osteoporosis, just throw in the chat box the one you like. We'll go with the democratically. Osteoporosis, PMS, how to have a happy pregnancy, rapid relief from TMJ pain, COPD, and increase your oxygen levels. So
you did it democratically, and everybody's picking one or the other. So the ones that already came in, somebody said, Ron just saying osteoporosis is my vote. Mark is saying COPD. Adam is saying TMJ. Christine is saying increase O2 levels. Another one for COPD, another one for TMJ. Margaret Blume mentioned too that, it wasn't one of the options, but this may be, round 3 when you do this, about having a healthy delivery baby.
Oh, how interesting. Yeah, we'll definitely do that one. I do have a program for that, how to
Okay.
have a healthy delivery.
So it looks like COPD was number 1.
COPD. So why don't we do COPD next? And what was number 2? Oxygen level?
It was actually TMJ that looks like I'm getting the most.
Really?
Yeah. And 1 for pregnancy.
How to have a happy pregnancy.
Yeah.
Okay, so let's do this. COPD next, TMJ next, and then pregnancy next. And I believe that will bring us to the end of this particular series. I could be wrong.
We'll double check on that.
Yeah, I'm not in a hurry to stop them, but but I think we can plan up these next 3. I'm so glad we're doing the COPD one, because as I mentioned, that's bad.
Yeah. And 1 is basically, I was going to answer that, but it was, she's interested in helping a patient recover from substance abuse, opioids, meth, cocaine, etc. So I think that would be about your addictions.
Right. The addiction
did.
one, if she needs the link, she can get it from Ben.
Okay.
If not, I certainly have it. Well, I have it online, but Ben has the link also.
Okay. And one other person, I guess it's a reminder that says, last time you said you would talk about substance abuse. So maybe you can save a little section of next week's or next month when you do that.
Okay, so I'm sorry that I neglected to do that. So I'm going to put COPD, I'm going to write right next to it. Substance abuse. And I will talk briefly about that in the next webinar on COPD.
Great. And just one more thing that I wanted to say is conception vessel 14. Ouch. So.
Oh, is it sore on you?
Yeah, it was sore on me, man. That was really one.
Yeah.
That's awesome.
Great. Well,
So anyway, Dr.
found
Baritz, it looks like, yeah, Rhonda, it looks like you did it. You guys did addictions or substance abuse before, but maybe Dr. Baritz can spend a few minutes at the next one covering that a little bit more. All right, Dr. Baritz, we are at the top of the hour, right on the dot as usual. Thank you so much for your time. Thanks everyone for logging in tonight. Definitely check out those links in there. And do you have any questions? Definitely email Ben or your rep in your area. We'll have a good night.
Good night.
Take care, everyone.